Do you think Cher thinks about me?
Yeah, probably. I know that for sure. Dolly Parton thinks about us.
Oh, I miss Dolly.
Dolly.
I messaged this
Dolly Parton.
guy. No, I was on Bumble, and this guy had Dolly Parton in his top artists, and I messaged him about it, and I never heard back from him, and I was like, that was a solid message. I don't understand.
Maybe he doesn't really like Dolly Parton.
I was like, hey, I see that you're a fan of Dolly. Did you see her at the Bowl last year?
He's probably ashamed that he didn't.
Probably. I mean, I would be if I had that kind of opportunity.
We went. Speaking of bands, yesterday I was at the dollar store.
Mm-hmm.
And, I have two stories about what happened yesterday.
Okay.
One of them, okay. So yes, I'll do the first one, then I'll do the second one.
Okay. Start with the beginning.
For the very beginning. I'm pulling into the dollar store. There's a man. It's so hot in LA right now. And we are in the valley.
Disgusting.
It's worse. It's way worse. There's
yes.
What I'm assuming was a homeless man sitting under the tree. This guy didn't say anything to anybody. He was just kind of wiping off his face. Was clearly uncomfortable, just dripping in sweat. I felt terrible because it's so warm. He wasn't talking to anyone.
Mm-hmm.
And this older woman cut me off to get into the parking lot and take a parking spot. Gets out of her car, says something to him. I couldn't hear what she said, and then goes into Family Dollar or Dollar Tree. I'm getting out of my car, and I go to the guy, and I'm like, hey, it's really hot. Do you need, water? And he was so grateful. He's like, yes, thank you. Water would be amazing. And, I haven't eaten in a couple of days. I really appreciate this. And it was just so nice. And so I go in, and I grab some things. And, I grabbed him, water and some washcloths so he could, get them wet and then keep them, on his neck or whatever. And, I don't know, I got him, bread and peanut butter or something that I thought he could, keep with him and it wouldn't get really gross.
Mm-hmm.
And I go to check out, and the woman who cut me off and said something to him was in line in front of me. And before she left, she's, putting all of her stuff in her purse, and she's like, do you allow people to just solicit outside of your store?
Oh.
To the guy at the checkout. And the guy was like, are you talking about the man under the tree? And she said, yes, that's who I'm talking about. And the guy was like, oh, I didn't see him saying anything to anybody. I thought he was just sitting under the tree for shade. It's hot out.
Yeah.
And she's like, no, he was asking people for money. I never saw him ask anybody for anything. But I thought that maybe because she could have seen me approach him that she got confused or was, I don't know. And so I was like, oh, I offered to get him stuff. He wasn't asking anybody. I offered, and she was like, he was asking people. A demon was released from this woman.
Whoa.
And I was just like, oh, okay, well, I didn't see it. Go about your business. Whatever. She stormed out, and then, I check out, and I go outside, and he's, walking away. And she's getting into her car. And so I had to, chase him down. He was kind of, at the end of the parking lot.
Mm-hmm.
And so I was, chasing him, trying to get him not to cross the street. And I gave him his stuff. And she pulled up next to us, and she told me not to encourage him.
Wow.
Yeah, and this is what, guys, I was so proud of myself. I wasn't, okay. Listen, I got a little angry with this lady, so I was not nice to her. But I texted my mom immediately to tell her what I said, because I knew I'd forget. I'm going to tell you guys what I said to her. So she told me not to encourage him, and...
Which, lady, it's none of your fucking business.
And so I was like, hey, I'm not the one. Mind your own business. And she was just like, he's probably on drugs or trying to rob you. Which... I get so mad when that's, the first thing that people go to when someone's homeless. I get so mad. And so that just, lit it inside of me. Because she didn't have any business being in our conversation. And, And so I said, listen, it's hot, because it was. I don't have the patience to teach you how to treat other people. No one cares what your opinion is, and no one invited you to be a part of this conversation. Go home. We all know what this is about. Your attitude isn't wanted here. So the man was African American, and I got the impression that that was part of the reason why this woman was so upset.
Of course.
And then she got really huffy and was like, you're just encouraging him. Again, like, that's the only thing that she can say. And then I said, I was like, I hope that I'm encouraging him to reach for help when he needs it, because even though, and this is where I got mean, there are old, frigid, privileged, white fossil bitches out there like you. My generation is out there too, and we care about others, and we want this world to recover from the left you mess for us. And then for the mess you left for us. Sorry guys, I'm dyslexic, so I wrote those backwards. I was like, now if you want to get out and talk some more, we can, or you can go home and think about how you're a sad, pathetic person, and maybe there's a little bit of time left for you to change that.
Wow.
I was so mad. Like, fuming.
It's like, why do you have to involve yourself? Like, if you want to be, like, if you want to just not help someone,
just don't.
That's one thing.
You could just not say anything.
You can just not say anything and walk away. But it didn't sound like this guy was doing anything to offend her except exist in a space that she didn't want him to be in.
And she was picking on him.
Yeah.
This woman who was driving a very expensive car, had a very expensive handbag, was in a better position in terms of, like, money. Privilege. And, yeah, 'cause she was a white lady. Was picking on this man. Like, stop. Just stop. Nobody
just
cares.
Go away. Just leave.
Yeah.
You don't need to.
You don't. Just, like Kid President says, just don't say anything. Just don't. So that was my first story. It was like,
just like when people have to be actively horrible.
I was
like, it's one that it's
Yeah, that was so that's my first story. My second story happened when I was in the dollar store, when I was inside. So I'm like walking around. I think I was with you.
Big active day.
At the dollar store it was, and all this happened within like an hour. I think I was with you when I bought it. I bought this dress from Forever 21. It's like this Iron Maiden t-shirt dress. It's cute. I wear it all the time because it's a great summer dress. I walked in and I noticed this guy kind of like staring at me, but I was just like, whatever, I'm not dealing with this right now. I don't care. Like, whatever you're looking at, I don't care. Whatever. So I go about shopping because that's what I was there to do. And this guy walks up and he's like, hey, I like your shirt. First of all, I was wearing a dress, by the way, so this guy doesn't know what the fuck he's talking about.
How do you get a dress and a shirt confused?
I don't know. wasn't like I was wearing pants.
Are you wearing
under
pants?
It. No, it's a dress. I'm not just walking around in a shirt. Although I would do that because it's hot.
It is hot.
And I looked down because I like didn't even remember what I was wearing that day, and I was like, oh yeah, thanks. Totally forgot. And then I noticed that he's like, not following me, but like he just so happens to walk down every aisle I'm in. And
he was waiting for another opportunity so that he could ask you to name 5 songs.
Yes! He walked up to me and he said, so do you even like Iron Maiden, or are you just wearing the shirt?
I hope that you didn't even qualify that with an answer, because it's not your duty as a human to, like,
I looked at him and I was like, no, I don't like them. No, I don't.
And fuck you.
I don't listen to any Iron Maiden. I don't like that band. And I was just like, kind of getting, because it was hot. I was like already like I was in the mood like, and so I was like, what is that? What's Iron Maiden? Is that a band? What is that? Why do you listen to them?
Please
I'm assuming you listen
me.
to them. Please tell me everything there is to know about Iron Maiden. And he was just like, I just wanted to know if you actually, like, listen to them or not. I was like, why does it matter? Bro, I came in here to buy a fucking water bottle, and you're keeping me from that. And then I just walked away, and he was, like, so huffy. He was, like, stomping around the store. He stopped some guy who had, like, his kid with him and was like, did you hear her yelling at me? And the guy was like, yeah, I heard her, and I agree with her. And he had a daughter, so I was like, oh, okay, cool. Yeah. At least there's that. But, like, it was that, and that is not the first time that's happened to me while I've been wearing that dress. That is the third time within the past month that has happened to me.
Ugh.
The other time, I was in the airport, and this guy walked up to me, and he's like, the same thing. He's like, do you even like Iron Maiden, or are you just, like, wearing that? I'm just
oh, my God. You don't own it.
I'm eating breakfast. Leave me alone. I don't want to talk to you. Who the fuck are you? Are you Iron Maiden? No, get the fuck out of here. Nobody cares.
It would be different if they approached it like, oh, hey, I love Iron Maiden, too. Like, what's your favorite album? And that's it. They come into it assuming that not that it fucking matters, because you can wear whatever you want. You don't have to qualify to wear a shirt.
No.
Like, do you go around asking people if they, like, competed in some 5K?
No.
Like, oh, let me see your record. What was your time? Like,
no. And you know what else I don't do? I don't, like, walk up to people and I'm like, hey, are you on the Detroit Tigers? Because they're wearing a fucking baseball t-shirt. I don't do that because, one, I don't care, and two, it doesn't matter. Like, it just doesn't matter.
Stop policing women's clothing.
It's not cute. And he definitely thought he was being cute when he asked me the first time.
Oh my God. Go away.
Stop. Ugh. Okay, so that brings us to our episode about not believing women.
Why do you have to come into this with an assumption that a woman is not qualified has no experience? Like, it's this general attitude that women don't know about things.
No,
including our own experiences and our own bodies.
I try to do it to men sometimes who I know do it to other women.
Yeah.
So if you're out there listening and you think that I'm guilty of it, it's because you're the problem.
Yeah.
Although those people probably aren't listening.
They're not listening.
But
that's fine.
Their friends could be.
Listen, if you see a friend do that, say something.
Because say something.
Your friend is being obnoxious.
Yeah, your friend's being,
and misogynist.
Don't encourage that behavior. Don't encourage it.
It's not cute. It's not a meet cute.
No.
It's not a cute way to meet someone.
Nope.
Just don't. Like, there are ways to, like, talk to someone in public and like start a conversation that are less aggressive.
Yeah. Or just, like, leave me alone.
Like, it's not our jobs as women, as we walk around the world, to, like, explain ourselves to you, justify what we do, what we wear, like, how we look. It's not our job to do that. Like, that is not what we fucking live for. No. We're very yelly in this episode.
Yeah, I've dropped many F-bombs. Hi, Mom.
I just feel very passionately.
Yeah.
And also, it's really hot.
It's really warm. We may stop our intro for a minute so I can make some margs. Some grapefruit margs. Because I've got
Margarita Sunday.
Some margarita glasses in the freezer that I got from the dollar store yesterday.
Hell yeah.
So I just want everyone listening right now to know that when we recorded part 1, it was a few hours ago.
And we were really hot.
And
we still are really hot.
It's just gotten more humid in my kitchen.
Because it's like the hot time of the day now.
Yeah, it's like hot time of the day. I think we're heading into like a little bit of the delirious part of humidity.
It's okay.
But it's fine.
We're fine.
It's fine.
It's fine. We're drinking so much water. Speaking of, we've been doing this for like 3 hours, and I haven't peed yet, and I've drunk a lot of water, and that makes me nervous.
I peed once, and I have to do it again.
Okay, good. You're probably more hydrated than I am.
But I'm also wearing a romper, and I don't want to have to take it off and put it on again. So
yeah, I told Heather, who we hear from in this episode, she bought a romper to wear out, and I was like, okay, it's really cute, but I'm just going to tell you this, because this is the thing that you don't think about when you're trying on a cute outfit, and you're going to go wear it out, and you're like, I look really cute. Rompers are not easy to pee in.
They're not.
And it only gets worse when you're drinking because you have to pee more and you're a little less coordinated.
Yep. Same thing with bodysuits. Bodysuits are easier than rompers.
Yes. Because you just do the pull aside.
I have gone home and realized that I never did my bodysuit back up after a night of drinking. That's happened several times.
That's fine. I don't undo it. I just pull it aside. I know that's kind of maybe asking for a little pee to get on my bodysuit.
I don't think I'm that coordinated when I'm drunk.
I do. I've done it. But I also don't buy ones that are super, super tight.
Oh.
So, like, they're usually a little looser on the bottom because I'm buying for what fits on the top. So usually they're a little looser on the bottom. So there's more give for the slide to the side. The slide to the side.
I have to buy for my bottom and not my top.
Oh, yeah.
So
we're opposites.
Yeah. It's like in order to buy so that it's not huge on my top, I have to buy so that it's like kind of a little tighter on my bottom.
Yeah. Yeah.
So it's just not good. So I just let it go. At some point during the night, I'm like, you know what? I don't need to do this back up. It's fine. Why'd I do it in the first place is what I think.
Honestly, nobody needs to concern themselves with that.
Mm-mm.
That is your personal bodysuit business.
I put it back on. Like, I pulled it down. That's all you get from me.
It's all about how it looks on the outside.
Yep. Appearances. Ooh. Should we get into this?
Yeah, I want to talk about my personal experience. And you posted this article recently on our social meets about, it's titled, "It Takes an Average of 2 years and 3 doctors to be diagnosed with PCOS."
Yeah. PCOS
is something that I talk about a lot because I know it's not very well known. And I was diagnosed with PCOS, which is short for polycystic ovary syndrome, about, I'm going to say like 12 years, no, probably more than that. No, I think it's like 14 years now. A long time. It's something that it's been part of my life for a really long time. It took a long time to figure out what was going on. Well, what PCOS is it's a hormone disorder, and it's basically a collection of symptoms. You don't have to have all of them to have PCOS, and even though cystic ovaries is in the title, you don't have to have cysts on your ovaries at all or at any given time to have PCOS. It's actually more about the hormones than it is about cysts. Like it's the hormone levels and the inconsistency and imbalance that causes the cysts on ovaries. So it's a poorly named disorder, but it's what it is. So it's associated a lot with infertility, diabetes, depression. It can be connected to thyroid problems or just generally metabolism issues. It's something that's severely underdiagnosed.
As with many things for women.
Yeah, exactly. Or misdiagnosed, or sometimes what happens is one of the symptoms is treated as an individual symptom. Like for me, my biggest symptom that I had, the strongest one, was depression. So oftentimes women maybe won't have other symptoms, but they'll have a very strong depression from an imbalance of hormones, and so they get treated for depression with antidepressants, which is actually not fixing the problem that's causing it. Or they may be misdiagnosed with like diabetes or insulin resistance, and it is associated with insulin resistance, but again, like if you go back to the main problem, which is an imbalance of hormones, that if you take care of that helps with all the other stuff. So because it's severely underdiagnosed, the best estimate that we have is it affecting 18% of women of childbearing age. I've read the number 10% before, which I think may be closer to the diagnosed
That makes sense.
rate. One of the reasons that it's so underdiagnosed is because a lot of times women never find out they have it until they're ready to have kids, until they start trying to have kids, because they may not have some of the symptoms, some of the other symptoms.
Yeah.
Like difficulty conceiving is one of the biggest things and one of the biggest reasons that people get diagnosed with it. And you may not know that you have it at all your whole life.
Yeah.
I'm convinced that my mom has it, but she's never been diagnosed because she didn't have trouble conceiving. So for me, my experience happened when I was probably about 16. I won't even go into like that experience because it was just, you know, a slew of doctors and tests and testing for thyroid conditions, testing for this and that, and lots of stuff. I think actually it wasn't as bad for me as it is for some people. I think it only probably took about a year, but that doesn't include the time that it took to figure out which hormonal birth control was going to be the best one for me, which was probably the worst part. Because you have to be on something for like 3 months before you can determine whether it's a good fit or not. And those 3 months are like the worst 3 months of your life because your hormones, which are already out of whack, are being put into like a whole other different level of out of whack. And so I was pretty lucky because I think it was the third birth control that I tried that worked, and I've been on it since then for about 14 years, and I've never gone off. And if I miss a pill, I like can feel it. Like I start to feel like crazy.
Yeah.
And really hormonal and just very reactive, and everything is like I know.
Yeah.
I know when I've missed a pill. Last year, my primary care doctor that I liked left the practice because she moved away. And I just got assigned to this new doctor who wasn't an internal medicine doctor, just a random doctor. Why you would replace an internal medicine doctor with just a general practitioner, I don't know. But they did. So I just went because I needed to get my birth control refilled.
Yeah.
Or a new prescription because I was running low. And when I got there, this doctor didn't know what PCOS was, I could tell wasn't listening to her when I was explaining it to her, because she then ordered an ultrasound to determine whether I had cysts on my ovaries, because she was insisting that she didn't believe that I needed to be on the birth control for PCOS. Regardless of whether I have PCOS or not, if I'm telling you I want birth control, just prescribe it to me.
But also, this wasn't like you were going to a doctor outside of what you had been going to before. This was the same practice, and you were just she had all of your information. She had your history in front of her. Why would she question what another doctor had done?
Because Yasmin is a very high dosage of hormones, and there's a lot of bad side effects that are associated with it for women that don't need the dosage of it.
Yeah.
Because it is very high, but I have very high testosterone levels when I'm not on it.
Yeah.
And so I actually need the extra estrogen. What makes some women go haywire is what I need to be normal, to be at a balanced level.
Yeah.
And there's like lawsuits and stuff attached to this particular drug. But like the thing is, I told her, I said, I've been on this for, at the time it was, I think I said 12 years. I've been on this birth control for 12 years. I have PCOS. You clearly don't know what that means. But I do, because I have it.
Yeah.
I need to be on this. Please prescribe it to me. She insisted that I go to 2 things. She insisted that she would only write me 1 month to hold me over, and that I had to go to a gynecologist to get the full prescription. And then she ordered the ultrasound to check for cysts, which isn't necessarily a bad thing. Like, I don't think that was a bad idea. It probably wasn't necessary because I've had it done fairly routinely over the last 14 years, every few years, and it's good to do it just to check and monitor because I probably do. I don't know for sure if this is true, but I think there is some associated higher risk with cervical cancer. But this is my favorite part because when she ordered the ultrasound, on the order, she wrote, because you have to put a reason, she put obesity.
Right. I remember this. I remember you telling me this.
And at the time, I was probably on the cusp of, like, overweight and obesity, like, technically at, if you're just looking at BMI. I mean, I think when I look at myself then and look at what I weighed, I think that's kind of bananas.
Yeah.
Because I wouldn't have called myself obese, but whatever. Like, if we're going to get technical, I was probably just below that level, but she decided that was enough. But she did not discuss my weight with me at all in this appointment. She didn't bring it up with me, like, in passing, or just saying, oh, I see that you've lost weight, or I see that you've gained weight, or whatever. She didn't bring it up at all. And then she put it on the reason on the order. So then when I saw that, because I was getting ready to leave, but I looked at the order before I left, I talked to the nurse practitioner, who is the sweetest, loveliest lady, and I love her. I was like, what is the deal with this? Because she put this down here, and she didn't even talk to me about this. If this was an issue, we clearly need to discuss it. I was like, I need to see the doctor again. I'm not leaving until I talk to her. So she came back in, and I was like, why did you put that there? Yeah. And she was like, well, I was like, why, if you thought that was a problem, why didn't you talk to me about it? And her reason was that she didn't want to bring it up because it's a sensitive subject.
That's your fucking job as a doctor, is to bring it up and discuss it.
Yeah.
Like, why not talk about it? And then, you're not obese, you weren't obese, but for her to be like, oh, let's talk about your weight for a second and maybe how that affects what's going on. Has this always been the case? Has anyone talked to you of that? Like, that's your job. She didn't
ask me anything about my weight. And I actually had, at that point, lost weight from the last time I was weighed at the doctor. And I think what she said was, well, I saw that you lost weight from the last time, so I didn't want to bring it up because it's a sensitive subject. And I'm not exaggerating. That's what she said to me. And I went off on her, and I was like, that's ridiculous. This is my health. You don't just make decisions and put things like that down without talking to me. If that's what you think is going on, you need to talk to me about it. And she barely apologized, and it was just, I did not go back to her because she was awful.
You fired her.
I fired that woman. Yeah, it was awful. And I did eventually go to the gynecologist, and then I found this, like, amazing doctor that's really awesome. And when I told her about that, she was, like, so offended. She was like, I can't believe that doctor said that to you and, like, did that. And she was like, I'm not really concerned about your weight. Like, I'm more concerned about what you're eating. Like, how's your diet? Like, what kind of foods do you eat? And, like,
the appropriate response for a doctor to have.
Ask the right questions, and it just, I still get so heated about it because it made me so angry.
Yeah.
That she just had no regard for me being, like, in knowing what was going on with myself.
Yeah, especially, like, I understand you're a doctor, but you don't know what would you call it a condition?
Yeah, it's a condition.
Yeah. What this condition is that affects a lot of women, and somebody's sitting in front of you saying, I have more experience in this than you. I know you're a doctor, but I do have more experience with this particular...
She did not like that I schooled her on what PCOS was. But she was like, do you have cysts on your ovaries? And I was like, okay, but, like, yes, that's what it's called. But you don't have to have them to have it. It's not just that. It's a collection of symptoms. Look it up. Like, and I don't think I was that... I was a little frustrated.
Yeah.
But I was trying to educate her and make her understand so that she would just write me the prescription.
Listen, you're a doctor. You're not God. Like, there is a level of respect that, like, if a doctor is saying, like, something to you, you should kind of, like, have respect for the amount of school that they went through. But
Right.
if they don't know what the fuck they're talking about, then they don't know what they're talking about.
I mean,
these are humans. Like,
she was treating me like I was trying to diagnose myself. Like, I understand that's a problem.
yeah.
But, I mean, it's something that I've been diagnosed with for 14 years.
Yeah.
And I've been on the same medication for it for 14 years, and it works. Like, I think I know what's going on here. Don't completely disregard my knowledge.
Yeah.
Because you're afraid I might file some kind of lawsuit. Like, why would I even do that? Like, why would I be so insistent on a drug, a particular medication, that you look at as being risky if I didn't know I needed it?
Yeah, and also, you've already been through all of this with previous doctors for the past 12 years. Why continue to put somebody through all of these tests? Like, they have a system, they have a routine, it's working. Just, like, be okay with that.
Just, like, besides the fact that if I just went in there and didn't say I have PCOS, if I just went in and said, hi, I need a prescription for birth control, and I want this particular one. I've been on it for 14 years, and it works for me. Can I please get this prescription? There shouldn't have been any question of that.
No.
It should have just been, okay, I can see here that since you've been with this particular practice, you've always been on this, it doesn't seem that you've had any problems, you don't have high blood pressure. All right, let's just do it. Because high blood pressure is one of the things, and I actually have anxiety about blood pressure testing, because it hurts, because I have a lot of fat on my arms.
Yeah, it hurts so bad.
I keep a lot of fat on my arms. Like, when I get the test done, if it's not if it's a machine and not a person, it hurts.
Yeah.
A lot. Like, it really hurts.
Yeah. That's why I won't do them at like Rite Aid.
Yeah.
I won't do it.
Well, and I tell them every time I go in, I say, I have anxiety about these machines. Can you please do it manually? And the reason I do that now is because one time they decided I had high blood pressure, because I get anxiety when the machine comes on, because I know it's going to hurt. And even when someone's doing it manually, I have to sit and breathe I have to focus so hard on my breathing so that it doesn't show up that I have high blood pressure, because I don't. I have all this anxiety about, not only about it being wrong, but also, like, what's going to happen if it shows up high, and then they decide that I can't be on my medication anymore because it does have an associated risk with high blood pressure. But, I mean, I think all birth controls do. But it's just, like, then I have, like, this whole thing that I have to go through in my head just to get through the blood pressure part of my doctor's appointment.
Yeah.
It's the worst. But one time I didn't have it, because every time after I checked it, after that, it was fine. It was just anxiety.
Yeah.
But now that's on my record, and so it always, like, that comes up every once in a while, and I have to explain. And if the doctor is a good doctor, like my current doctor, and I say, I have anxiety about the machine, that happened one time, and then since then, I always ask for it to be done manually, and I've never had high blood pressure since then. And then she'll say, oh, okay, that's fine. Don't even worry about it.
Yeah.
So.
Ugh.
It feels good to get that out.
Feels good to get all this out. You were talking about birth control prescriptions, and I just wanted to bring up my current gynecologist, who I love. I talked about before. The funny one. She wrote my prescription for the NuvaRing, and on the prescription, I don't know why she wrote this, but on the prescription she said 1 ring per vagina.
Do you think she did that as a joke? Like, she thought it was funny?
I really hope she did, because I thought it was hilarious. And she said she's a funny doctor.
That is so funny.
It is funny.
I love it.
We've mostly been talking about white cis women.
Yeah, and also just, like, personal experiences.
Yeah.
And I think it's important to talk about things more broadly, and especially how this issue affects certain specific intersections of women. So one thing I found was in 2002 there was a report. I know that's kind of, at this point, a little outdated, but it's the best the best I could find on this.
And we just, like, we don't want to give facts that we can't confirm. So sometimes, like...
Yeah, so, I mean, I'm not going to just go onto some, like, Think Progress article and just pull whatever headline I can find. Like, we're not just giving random facts without reputable sources here. So, excuse us if it feels a little outdated. Just logic tells me it probably hasn't changed all that much.
Yeah, it still feels relevant.
And regardless, it's at least where we came from. So the Institute of Medicine reviewed hundreds of studies of age, sex, racial differences in medical diagnoses, treatment, and healthcare. They found that for almost every disease studied, Black Americans received less effective care than white Americans. And here's the thing that makes it even more extreme, is that the disparities persist even when they match for socioeconomic and insurance status. So we're talking about Black Americans that are like whatever the class or income level is of a person. If they're Black, a Black American versus a white American, they're being diagnosed and treated differently. And I mean treat in terms of treatment. They also receive fewer recommended treatments for diseases just in general. Just less recommendations. And they specifically found gaps with blood pressure, cholesterol, and glycated hemoglobin, which is not easy to say. There's differences between Black and white members of this particular health maintenance organization. And then a whole different level of things is when you look at how implicit bias, which is basically prejudice, right?
Yeah.
It's how your prejudice affects how you view things and make decisions.
Yeah.
Can also influence administrative decisions, like, for example, which insurance plans a health office decides to accept, where they decide to like locate their office, like what neighborhood, and like who's around in that neighborhood. There's decisions like that also affect the access.
Yeah.
And of course that's something that's really hard to quantify and study.
Yeah.
So it's something that we kind of know that it's like it's a bias there, but it's really hard to give a number, a statistic on which insurance providers are accepted at certain health offices are accepted, like what effect that has. It's so hard to like quantify that.
Yeah, it is. Another thing that I wanted to point out and just mention is that your economic status has a lot to do with it. I'm very lucky that I work at a job where I get health insurance. Most people don't. I know a lot of people who don't have health insurance, and I know a lot of people who kind of rely on clinics that are understaffed and overrun, and just that's hard to get a clear diagnosis on anything when you're there, not for lack on necessarily the doctor's parts, but just for lack of responsibility from our government putting money that needs to be into those facilities.
Yeah.
And I know people who have gone to like a clinic and waited 8 hours to see a doctor for 3 minutes because it's literally all the doctor has, and you can't get a diagnosis in 3 minutes from talking to a stranger. You can't. And when that's your only option, like your diseases or your ailments or conditions, they're going to go untreated.
Yeah.
Or they're going to be treated
and they make it
incorrectly.
worse.
Yeah, and that's life or death for a lot of people.
Yeah, and I think that's something that disproportionately affects women, because women are more likely to work in certain industries, like service industries, where you may not qualify for benefits, or you may not be given enough hours on purpose so that you don't qualify. Like, that's something we've talked about before that disproportionately affects women.
Yeah. Women will take career paths or different job choices so that they are allowed to take care of family, or they're allowed, more time to do other things that need to be done as well.
Yeah, I mean, it's a fact that women, I read this recently, I forget where, but women take care of parents a ridiculous amount more than men do. They even take care of their in-laws more than men do.
And that's not the in-laws, but their own parents. It's a very American trait to have. In other countries, it tends to be more of the responsibility of the son to take care of his parents when they're older, or of just like the eldest sibling. Like that's what you do. You stay home and take care of your parents. But in America, it's very much the women who are going back and even kind of uprooting their lives and going back, which affects their career and
and how much they can work, which can affect their access to healthcare. And then, of course, also women and men and non-binary people as well are in the LGBTQ community also are facing their own discrimination and bias as well. And of course, we have to remember that some people are in both of those categories. They may be a person of color and someone in the LGBT community. Like, there's all these intersections. These things stack up.
Yeah.
A particular study that I read about says that 30% of transgender Americans have experienced discrimination in a hospital or doctor's office, and 80% of first-year medical students express some form of bias against gay and lesbian people in 2015.
Jeez.
Which is really, really high. I mean, the conclusion is that a big part of the problem is that so little time is devoted to LGBTQ-related health issues in medical schools. There's a study done with 132 schools, and the median time dedicated to LGBTQ health in an entire doctor's education totaled 5 hours.
Wait.
5 hours total.
Oh my God.
And I don't know how many hours the total of all of it. I know it's a lot, though.
Yeah.
They do a lot of hours.
That is a lot.
That's just, wow. There's no excuse for that at this point?
No. I'm just curious, like, how many medical schools have a religious affiliation?
Well, yeah, I think it's a lot.
I think it's a lot, too, because I'm just, like, thinking off the top of my head.
Yeah, I don't think that that's not related. I don't know if, I mean, it's something that it would be hard to prove, but
yeah,
I don't think that that's random.
I'm just curious.
Yeah. So now that we've talked about more things in the broad landscape, let's hear some more personal stories, because I think that they really illustrate the points that we're talking about here.
Yeah.
Hi, SheSplain. This is Heather from Washington, D.C. The story starts probably about 8 years ago. So I was at the gym on the elliptical. I was probably working out, like running a little more intensely than I usually do, because I was, punishing myself for eating a big brunch. And I finished my workout. It was just like, 45 minutes to an hour of like high intensity cardio, but like not anything I couldn't do. I was driving home and I realized, like, holy shit, like, I can't breathe. And my fingernails turned blue. I had to go to the emergency room and, get oxygen and have them check me out. And, they didn't really know what it was. They were just kind of like, go home and calm down. It's probably just your anxiety. And, it definitely wasn't the last time that I ever had trouble breathing. But after that, I sort of had the notion that it was all in my head. And, I would go to doctors. I'd probably been to about, 5 in that time. And I would tell them, sometimes it was really hard to breathe and my heart would beat really fast or my chest would get really tight. And they all just told me it was in my head and that it was anxiety and I just needed to calm down, And another doctor told me I should maybe drink less coffee because that was making me antsy and make my heart beat really fast. So flash forward to a year ago, and I was at an allergist who's also, she's like an asthma allergist combo deal. I don't know. I guess that's like a thing. But I was there to get tested for a coconut allergy that I have just to, have it verified. And I guess the thing that they make people do at this doctor's office is to take a lung capacity test because they're also an asthma place too. So they made me take this lung capacity test literally 9 times because they thought that I was maybe like botching the lung capacity test because my test showed that I had the lung capacity of like a woman in her upper 50s. And that couldn't be right because the only reason that would be a thing is if, I had asthma. So after a while, my doctor, who's a woman of color, by the way, shouldn't surprise you, she thinks, okay, maybe all these other doctors have missed something here. And they give me just a standard inhalation of, asthma medicine. And within 15 minutes, my lung capacity increased by 20%. So what I discovered a year ago is that I have adult onset asthma that I have been told for the last, 8 years that it was anxiety and all in my head. And if any of those doctors had thought to give me a routine lung capacity test that you could do basically anywhere, I would have felt relief so much sooner. The fact that I even know that that's what it is makes me feel so much more calm because I know that whatever is going on in my body that's making my chest tight and making me wheeze a little bit, I can control. And it was funny. My doctor was just completely shocked when I told her that none of the physicians I'd seen had even suggested that I do a lung capacity test. I always felt that women needed to advocate for themselves and their symptoms more than men because we live in a sexist world with a medical industry where professionals statistically take our symptoms less seriously. But, having it actually happen to me really hit the point home even more. Thank you so much for listening. Love you all. Bye.
Another frustrating story. I was going to say tale, but it's not a tale. It's real. It happened. We're sorry.
Thanks, Heather, for sharing.
Yeah, thanks for sharing and sending that in. I'm sorry that happened to you. What bothered me, not the most, but something that really bothered me when we were listening was when she said that her fingernails turned blue.
Yeah.
And they were like, oh, it's just in your head.
Right. Yeah, that's like a really serious physical symptom that is obviously related to your oxygen level, right?
Yeah.
So even if it is psychological, it's something that needs to be figured out, whatever's going on, because it's having physical symptoms.
Yeah. Like, did they think...
Just telling someone to calm down.
Also, telling me to calm down is the number one thing that will just rile me up even more.
Me too. My boss and I were just talking about that this week. how people will tell you to calm down and like, what are you trying to accomplish with that? Because if you're trying to get me really angry, that's good job.
That's the exact way to do it.
It's gonna work.
Yeah, that's really frustrating.
Yeah, it's when you know something's wrong and then people are telling you that it's something else or it's just not that serious or
that it's in your head.
It's not.
It's not in your head.
And it sucks because as women we have to like we're raised to trust certain kinds of people, like people of authority, and also to like not cause problems, to like diffuse situations and stuff like that. A lot of times just because to protect ourselves as a self-preservation thing.
Yeah.
But in situations like this, you really have to advocate for yourself and be confident enough to say like, no, it's not in my head, there's something going on here, and just ignore the people that are not helping you or replace them or whatever. But that's really hard because it goes against the nature of a lot of women.
Yeah.
Not everyone, I mean.
Yeah.
And sometimes as you get older, you get better at advocating for yourself, but it's hard. It's hard to do that.
It is, especially for younger women, like you said. I think that because you're just like, you're starting to learn and be more comfortable in your own skin with other things, that it's like, it's difficult to just have that confidence that men have. And
you shouldn't have to. You know, it shouldn't be your job to have to fight so hard just to have what's going on with you taken seriously.
I wonder how many people are out there with serious illnesses or ailments and there's like nothing that can be done for them because they can't advocate for themselves.
Yeah.
And they're just in a situation where their doctors aren't.
Say you don't speak English really well.
Yeah.
And if you don't have someone that can be there to help you, you're not going to be able to.
That's a really big thing. I wish I would have thought to do more research about that and to talk about it.
Yeah.
Because it's, especially in California, it's a really big deal and it's a huge issue. My boss's housekeeper's husband, he doesn't speak English. He's not a woman, but this is one of those situations where he doesn't speak English, and they, at the time when he started to like sort of feel sick, they weren't citizens. They were getting their citizenship, but they weren't citizens. Mm-hmm. She's now a citizen. But he just passed away recently from a brain tumor. Oh. Like, no one would listen to him, the people that he felt comfortable going to. And I don't know if it was that they wouldn't listen to him, but they probably didn't have the means to explore all of the scenarios that could be wrong with him. Yeah. But it was just like a lack of medical care, and there was just nothing to be done. I mean, I think that my boss tried to interject herself.
Yeah. But yeah, I think women in particular have more barriers to getting the care that they need. Mm-hmm. Obviously, that's going to vary across different intersections.
Yeah.
But yeah, and especially how it comes down to socialization, too, is like as a woman, as a girl, you're told over and over again not to make splashes, like, mm-hmm. you know, listen to what you're told, all of that. And it takes a lot of work to get past that.
Yep. And we've talked about this before, but like for women in areas that don't have the best healthcare options, it's like you are literally having to choose between eating and going to a doctor who's going to listen to you, or like feeding your family because it's time off of work that you don't get and you don't have coverage, so you're going to a clinic, or mm-hmm. just kind of like an urgent care. I know someone who goes to like urgent care as their primary care, but it's the only option that they have. Yeah. And it's kind of just like get in and get out.
Mm-hmm. So now we're going to hear from Cassie. She didn't want to record herself, so I'm just going to read it out. Her story. Here we go. When I was 29, I was in a minor car accident and sprained my foot. No one would listen when I told them the problem was my foot, not my ankle. I went in for a follow-up visit, and my doctor lectured me about my weight before he would even look at my bruised and swollen foot. He also informed me that losing weight would help with my symptoms from a car accident. I tried to play nice because he wasn't wrong exactly, and told him that, at least before the accident, I exercised 6 days a week and was on Weight Watchers. Instead of saying, okay, cool, moving on, he lectured me on how Weight Watchers only works if you follow the plan. He still hadn't even looked at my foot. So, Cassie, we're so sorry that this doctor treated you so awfully. That's really unprofessional.
Once again, the opposite of how a doctor should handle anything.
Yeah, like, that's not helping.
No.
You know what? Maybe weight could be exasperating a symptom of pain, but it's not the cause, obviously, because the cause was the car accident.
Yeah.
And focusing on something that she can't change immediately, because even if the solution is to lose weight, that's not something she can do tomorrow.
No.
Like, that's not going to help the current symptoms of pain.
No.
Not only that, but not believing her that she was following the Weight Watchers plan.
Yeah. That doctor's a jerk.
I hate that guy.
Yeah.
Sorry,
it's so
Cassie.
frustrating. I hate that the first thing that doctors go to for women is weight.
Oh,
It's the
right.
number one thing.
It's either about your reproductive health in some way, or it's weight.
And obviously, like, looking at people, you can tell, like, that, like, you can tell that I weigh more than somebody else. And you can tell that someone weighs more than I do. But you can't look at someone and tell if they're, and you can't look at everyone and tell if they're immediately healthy.
No.
So if this doctor was just looking at her and was judging just based on how she looked, and it's his preconceived idea of how much weight should be on her body, he was just giving his opinion.
Yeah. Not wanted, dude.
Not wanted.
Bye.
Retire. Go.
Fire that guy.
Fire him. Fire that doctor. Thank you for sharing your story, Cassie. We appreciate it. We're sorry that guy was so rude. I wish
If I could fire him, I would.
I wish I had a better word to call him.
So rude.
So rude.
How rude!
How rude.
So, as you can tell, it's something we feel very passionately about. I think it's something that is an issue that resonates with a lot of women because probably most of us have experienced some kind of mistrust or bias. Even if you can't really prove that it's because of who you are, it's there.
Yeah.
And you feel it.
Keep telling your stories, ladies. You can send them to us still, too.
Yeah.
We could maybe do a second set or even do, like, a special. Like, keep telling us.
Yeah, share your stories. Talk about it with other people. I mean, and not just women. Like, talk about these things with men because I think it's important
Yeah.
for men to listen to our experiences and understand them and realize. And the more they hear about how things are different for people that aren't like them, the broader their understanding of the world becomes.
Yeah.
So don't just write people off just because they have a different experience than you and only want to commiserate with people that have experienced what you have. It's important to share your stories with all types of people.
Yeah. And you would be surprised who wants to learn.
Yeah, and you're not alone.
Yeah. So
Don't ever feel like you're alone.
we're here.
We're always here. We'll always listen.
Unless you're a jerk.
You can find us on the social medias.
Follow us.
We're at SheSplain Podcast on most avenues.
Yeah. Most of them. Most avenues.
On Twitter Avenue.
Twitter.
We're at are we SheSplain Podcast on Twitter?
Yeah.
Listen, if you type in SheSplain, we will pop up. We are all over that.
Yeah.
Even if you just Google it. And again, don't forget, guys, if you don't want to write a full review, you can always just give us a quick little 5-star rating.
Give us the stars.
On Apple Podcasts. It's so easy. Some people did it after our Momsplain episode, and we so appreciate it.
Yeah, we We love that.
And now, like, we even have a rating when you just click on the main thing now. Because we have enough ratings that we show up.
Moving on up.
Mm-hmm.
Yeah.
Mm-hmm.
And
But
tell
also,
your friends.
Tell your friends. Share your story. Just share the love.
Also, like, feel free to tell us what you don't like.
Mm-hmm.
That's fine.
Doesn't mean we'll change it.
Yeah, we might not change it and we might not agree, but, like...
But we will listen.
We welcome feedback.
Unless you're just gonna be like this person that sent me a message on OkCupid that said, "No wonder you're a feminist. You're really ugly."
Or, like, if you
So,
do
I mean,
that,
go
just,
ahead.
like, don't expect us to care.
Just know that I'm laughing at you. Follow your heart. Follow us on social medias.
SheSplain.